Hello everybody and welcome to Gene's Reviews from a regular dude, where I do trailer reactions, I react to YouTube videos, I review YouTube channels, occasionally I'll review a movie, but really, I just do whatever the hell I want. Hello everybody and welcome to Gene's Reviews from a regular dude, down in the basement. Okay, this video was sent to me. Thank you, Dana. And this is called the Top 10 Oddest Dental Cases. And this is from the channel They Will Kill You. I did one from these guys a few days ago, so let's check this out.
Number 10. Sprout implants. According to a report from an American news outlet, a patient had gone in for a root canal treatment when the dentist noticed a seed lodged in their gums. After a conversation with the patient, the medical specialist determined it was a tomato seed. During its removal, the dentist noticed that there was a tiny plant sprouting out of it. Remarkably, this wasn't the only reported case of a plant growing inside a patient's mouth. A Taiwanese man who reportedly had
Okay, if you want to grow tomatoes, I would advise, grow them outside, don't grow them in your mouth.
poor oral hygiene, had to have one of his wisdom teeth removed. As the dentist took out the tooth, they found a guava sprout growing inside it. Since one of the man's bottom teeth was missing, the seed had had sufficient space to develop after it got stuck. Number 9. Wu Xiyu. When he was 11 years old, Chinese man Wu Xiyu had an encounter with a wolf, which left him scarred for life. There have been several reported versions as to how the interaction unfolded. Some sources claim that the wolf viciously attacked him, while others maintain that the animal simply licked his face. According to the latter version, the wolf transmitted a bacterial pathogen which caused Wu to develop a disease called noma. This is a rapidly developing gangrenous infection of the mouth's mucous membranes. The painful ulcers affect muscular tissue as well as some of the bones in the face. Whether he was attacked or contracted noma, Wu's mouth was entirely ripped apart and his jaws were left distorted. As a result of the severe disfigurement, Wu's teeth were permanently exposed. He would go through much hardship as a result of his appearance. Into his late 60s, the man never married, went to school or had a job. He could only eat liquid foods, and people in his village in the Guizhou province would generally avoid him. In 2014, a team of surgeons began a massive operation of reconstructing Wu's face. It involved 20 specialists from 10 different departments. The operation entailed transferring muscle from his legs to the mouth and, afterwards, a full reconstruction of his teeth. Number 8.
Okay, I don't see an attack doing that. The way that it looked, that looks almost like he was just born that way. But then again, they were saying that it was something that the wolf had given to him by licking his face. So I'm kind of going to go with that on that one, because it doesn't to me look like his face was like ripped apart so much by the wolf. Let me know what you think.
8. Ashik Gavai. For over 18 months, Indian teenager Ashik Gavai had been suffering from a swollen jaw and severe tooth pain. His parents eventually decided to travel from the village and take him to a Mumbai hospital. It was there that doctors discovered over 200 teeth had formed in Gavai's mouth. This was due to a very rare condition called a complex composite odontoma. It's a type of benign tumor that involves a single gum forming many teeth. The tumor was buried deep in the lower jaw, and doctors couldn't cut through it at first, so they used a hammer and chisel to crack it open. They then started extracting small, pearl-like teeth. They counted roughly 232 of them. While certainly shocking, Gavai's odontoma isn't the most severe on record. In 2019, a child from India's Turavala district near Chennai had surgery to remove 526 teeth from his lower jaw. The bag-like mass in which the teeth were crammed together weighed roughly 7 ounces. This is almost twice as heavy as a pool ball. Number 7. Gum hit.
Gives a whole new meaning to the word toothache. Oh, man.
In 2009, A young woman went to the University of Campania Luigi Vanvitelli
Gum
in
hair.
Italy with a rare disorder called gingival hirsutism. The unnamed 19-year-old had scattered eyelash-like hairs growing on her gums behind her front teeth. There are only a handful of such cases in medical literature, and professionals aren't entirely sure why the condition occurs. In the woman's case, it was attributed to hormonal imbalances relating to polycystic ovary syndrome, or PCOS. The protruding hairs were surgically removed, and the patient was given medication to rebalance her hormones. 6 years later, however, she would return to the hospital. The woman had stopped the hormonal treatment, and the gingival hirsutism returned. After removing the hairs, doctors also took a sample from the site. They examined it under a microscope and found that the gum tissue was unusually thick, and hair shafts were pushing their way through it. A year later, the woman's condition worsened, with hairs appearing on other sites around her mouth. One of the hypotheses regarding gingival hirsutism is that the tissues responsible for building skin during the embryonic stage are closely related to the mucosal tissues of the mouth. This would in theory explain the activation of hair cells, but the triggering factors remain largely unknown. Number 6. James Mwangi.
So instead of the hair growing on the outside, it's growing on the inside. That's pretty weird. But at least it's not so noticeable like that other Chinese guy, that poor guy, has to go around everywhere with everyone seeing it. She could keep her mouth closed and no one would even know.
After James Mwangi was born in Kenya's Undunduri village, it quickly became apparent that he was unlike any other baby. As Martha Matoni, the boy's mother, tried to breastfeed him, she felt a powerful bite. Upon closer inspection, she found that her child had nearly a full set of teeth. When Matoni told her husband, the man reportedly freaked out and walked away. A few days later, he had to report for work in a different village, leaving Matoni to care for the baby alone. She took him to a nearby dispensary, where the examining doctor claimed he'd never seen anything like it. The child had a total of 28 teeth.
Wow.
While some of Matoni's neighbors were simply curious about Mwangi, other residents of the village feared that he possessed magical powers. Number 5. Tooth in the nose. In February of 2019, the BMJ Case Reports Journal presented the odd occurrence of a patient who had a tooth in his nose. For over 2 years, a man in his late 50s had been complaining of a blocked nose and the loss of his sense of smell. He went to University Hospital Aarhus in Denmark, where doctors performed a sinus CT scan and found a tooth growing in his nostril. It
Wow.
was determined that the unnamed patient had an intranasal retainer.
Look at that. You can even see it. When he lifts his nose up, you can even see the tooth in there. That is crazy.
Tooth. This is a very rare condition, with only a few dozen documented cases, and is caused by developmental problems or physical damage. However, the intriguing aspect is that the patient had suffered none of that in recent years. When he was younger, the man had had reconstructive surgery to mend a broken jaw and nose, but doctors still couldn't find a link between the two incidents. The patient recovered after the growth was removed, and he followed a 10-day course of antibiotics, coupled with nasal saline irrigation. Number 4. Angie Barlow. When Angie Barlow's mother went to have a tooth removed, doctors found that she suffered from throat cancer. The woman then succumbed to the disease at only 34 years of age. This chain of events subsequently left Barlow terrified of going to the dentist. The lack of upkeep, in combination with her heavy smoking habit, eventually caused the woman to lose several of her top teeth. Since her fear of the dentist was too great, Barlow simply put them back in her mouth using superglue. The substance had a devastating effect on the bone.
I've heard of people doing that. I've heard of people making their own dentures that way.
Her top teeth. Since her fear of the dentist was too great, Barlow simply put them back in her mouth using superglue. The substance had a devastating effect on the bone supporting the teeth in her top jaw. By basically creating her own dentures, Barlow had lost roughly 90% of that bone tissue. The glue teeth were also aesthetically problematic and made the 48-year-old woman feel self-conscious to the point that she'd become a recluse. Whenever she talked to someone, including her own son, she'd put her hand over her mouth. Barlow ultimately had no choice but to seek professional help. The professional dog walker reportedly spent her life savings to have the upper part of her dentition rebuilt. 11 teeth were removed and 6 titanium screws were inserted into her jaw, with 12 new teeth permanently attached to them. In the aftermath, she reported a major improvement in the quality of her life.
Good.
Number 3. Anna Cardoso. In March of 2015, Anna Cardoso was taken to a hospital complaining of a tingling sensation in her gums. For days, the 10-year-old had told her mother that she felt something moving inside her mouth, but the woman thought she was joking. There wasn't anything visibly wrong with the child, and she wasn't in pain. A trip to the dentist would reveal an unsettling truth. Much to the shock of everyone in the examination room, over a dozen maggots were discovered living in Anna's gums. The dentist used a pair of tweezers to remove each of the wriggling larvae from her mouth. The disease, called oral myiasis, most likely arose as a result of Anna eating food contaminated with fly larvae in their incipient developmental stage. It's a relatively rare condition, as the oral cavity doesn't really provide the right habitat for the larval life cycle. Fortunately, the child recovered from the infection without any lasting damage. Today's topic was inspired by Sean Gorman. If you have any other topics you'd like to learn about, subscribe and let us know in the comments section below. Number 2. Wang Pengfei. Teenager Wang Pengfei from southwest China presented an odd condition, which has been described as vampire teeth. The 16-year-old's case was reported when he went to a local hospital for medical tests in 2012. Throughout his childhood, instead of a full set of teeth, Pengfei had only developed 2 sharp canines. In his teenage years, the condition caused him to become withdrawn and even violent towards classmates, who stared or made fun of him. According to his mother, he didn't want doctors taking photos of him and barely agreed to an x-ray. Surgery for mending the teeth and the subsequent implants was estimated at close to $10,000. However, due to the complexity of the operation, doctors told Pengfei he'd only be eligible for it as an adult. Official day.
That's one of those things where kids make fun of you, tell them knock it off or you're gonna suck their blood.
They Will Kill You merchandise is now available at theywillkillyou.com. Some of it is to die for. Number 1. Stephen Hurst. For over 30 years, Englishman Stephen Hurst had been suffering from excruciating pain in his right ear. He had trouble sleeping and concentrating as the pain was constant, and he'd even developed partial deafness. The problems had started when Hurst was a teenager and plagued him into his 40s. In his youth, the headaches would reportedly get so bad that he would scream out or bang his head against the wall. He frequently had infections and was forced to give up his job as a miner because of his condition. Hurst visited various specialists, but none could tell him what was wrong. Then in 2010, he got an appointment at the Royal Hallamshire Hospital in Sheffield. After using a suction tube to clear his ear canal, the baffled doctor asked Hurst if he'd recently lost any teeth. The man replied that years had passed with him having none of his original teeth. The doctor then revealed that for decades, Hurst had been living with a tooth lodged in his ear canal. It was a first tooth, judging by its small size. Hurst had no idea how it had gotten in his right ear, and believed that he must have simply pushed the tooth in as a child and forgotten about it. His right eardrum had disintegrated as a result of infection, but all of his painful symptoms disappeared after the tooth was removed.
Wow.
Thanks for watching.
That's crazy. Earaches are the absolute worst. Then toothaches. I haven't had an earache since I was a little kid, but oh my hell, those hurt so bad. Ear infections, they're the worst. Okay, how about a joke? You know, unexpected sex, it's a pretty great way to be woken up. Unless you're in prison. Thank you, everybody. Make sure you like, comment, subscribe, hashtag Mean Gene, all that fun stuff. And if you like this video, tell all your friends, leave a comment down below. And if you didn't like it, then just shut up. And I will see you next time.